there is a debate that has started. In fact, it started in the late 1990s. Thornycroft wrote a paper on it, I remember, you know, talking about efficacy and effectiveness. And I would like to see that debate sort of revived. And it's what he was essentially saying is that, you know, when we've done the randomised controlled trials and we have a body of evidence that says, actually this way of providing services is better than that way of providing services, then we don't need to keep doing randomised controlled trials. We've got the efficacy bit sorted. We need to do effectiveness research under real situations with real people. In other words, not highly selected samples. There's a lot of talk about kind of, you know, pharmaceuticals and drug testing and so on. You know, a lot of drugs are tested on healthy young males. Now, they could be for, you know, women, for example. They could be for children. But, you know, the preferred testing group is healthy young males. So that is such a highly selected sample. It's absolutely of no relevance to the people who will be using the drugs. Or in this case, the service. So you have randomised control trials that exclude, you know, 18 to 65, a very narrow diagnostic group, no other problems, you know, nobody's using alcohol or drugs, I mean. And then that is supposed to translate to the real world where service have to deal with people of all ages, of all diagnoses, who are using alcohol and drugs, you know. So, I mean, I think there's a space for, you know, a debate about and challenge of this evidence hierarchy. So that's one of my soapbox rants over with. You'd be relieved to hear. On better research. What else did I got to say about that? Yes, okay. Another important point, and I think Alison and Jan and I mean everybody spoke about this today, was the quality of research. And research must be of good quality. I mean, that's the other bottom line in producing, in service users being involved in research. So, you know, there was a lot of talk of ethics and so on. Well, it's really, again, fundamentally unethical to use scarce research funding and to involve people in research protocols if your research is not of sufficient quality to produce reliable findings, you know. And I think we have to be able to step up to the mark in that, and everybody was paying really close attention to that in terms of training and how our research is done. What's that? There's no possibility. Yeah, exactly. Yeah, that's that point. Now, what's the next one? Again, something everybody touched on today, and very strongly, the possibility of achieving change. I think the possibility of achieving change is much higher in service user-led or service user-involved research. Jan gave some very concrete examples of that, of a piece of service user research leading very directly to a change in guidelines that doctors are obliged to follow. You know, and if they don't follow them, they have to be able to defend their actions very strongly. So, you know, okay, that's the system that's in place, but that is one way of influencing practice and of making a real change in terms of the services that are experienced by service users. And in some Irish, the gentleman gave some great Irish examples. I would go back to one Paddy mentioned, which was the piece that the Irish Advocacy Network did for Vision for Change. That was a very important piece of research for several reasons. I mean, it was very valuable in itself in giving a really good insight to a group that hadn't been looked at in that way before. You know, people who are kind of on the backwards, the really neglected area of our mental health services. But that piece fed in very directly to the deliberations of the group that produced Vision for Change. I worked with that group in producing that document. Now the implementation bit is another piece, but in terms of producing mental health policy itself, it was very interesting to experience the kind of change in mindset of that group overview, which was largely, which was dominated by mental health professionals, particularly consultant psychiatrists. If the policy, you know, if the policy had been produced within a couple of months without the consultation process and that piece in particular that the Irish Advocacy Network carried out, it would have been a very different policy, and I think very poor policy. But it served two useful purposes at least. One was the bare facts of what the policy needed to achieve. It really needed to address the needs of these people. But also, for others on the table who were really trying to push things like recovery, like the importance of the service user perspective, we were able to refer constantly to, well, hold on, in the consultation people were saying, we want this, this, and this. They weren't saying, we want what you're suggesting. So it really did shape the policy that was produced. And I think they're really concrete examples of how service user-led research has a real impact and has an increased possibility of achieving change. The other area that, again, was mentioned by all the speakers is the importance of research, learning about research and doing research in developing the skills and really empowering service users. Hold on now, I have to find my piece on that. A few different things here. I suppose there's I was struck by, I think it was Alison who mentioned the kind of universality of what helps. In other words, what helps service users as researchers is what helps all researchers. It doesn't have to be anything special. Okay, there may be a need for additional flexibility as a working parent, as I'm sure lots of you are. You know, everybody needs a bit of flexibility in the workplace. You know, the need for additional support. I think they're all things that all researchers need. So, in other words, a good working environment for service user researchers is a good working environment for all researchers. So I don't think there's anything, I think that universality of that is a very useful point. The capacity building, there was a lot of mention of capacity building. I think there are a lot of specifics we could drill down to on that, and maybe that's something that fits into the second heading of how to move forward, and lots of interesting ideas I think were coming from the different groups here. I suppose at a simple level, information sharing, and I don't just mean information about services, but information about research and how to do research. You were mentioning this yourself, Mike, in terms of even people feeling empowered because they're very centrally involved in a research process. Training is really important, and there are lots of people here training service users to do research. Again, to try and harness that, and I'm kind of moving on a bit to the second question, how can we move this forward? How to harness that centrally would be really useful. I know SOURCE, for example, have a really great training manual already prepared for training service users. So rather than another group feeling they have to start from scratch, this amount is too high, we're never going to get all this material together to even start training. That's already been done, and I'm sure that's something you'd be happy to make available. Paddy and Jim are training service users in interviewing skills and providing research supervision. So there's a lot of training already going on. I suppose that needs maybe to be pulled together in some way and made available as a more or even just that it is a resource that is available. I think there are lots of positives. The NSUE, the National Service User Executive, presents a structure, representative structure for service users. That's there. That's in the process of coming together. So in terms of having a central structure for maybe guiding research or guiding this kind of action, that's there.